Good evening once again, and welcome to today's session. As I told, today is our 1365th day of uninterrupted webinar. Thank you all the participants for your interest and enthusiasm. That if you are not being our part, we don't conduct this webinar. And thank you all the faculties, members, and those who are working hard behind this. Thank you for everyone. There are many struggles behind conducting this program. So thank you everyone for your participation and real heart, putting your real heart in this organization. And today's our guest is Dr. Arvind Kothe. He's MD in homeopathy. He has many positions. I don't know how to say. He was he was a director of Jim's Homeopathic Medical College, Hyderabad, and he was a member of. He's the member of Special Committee of Clinical Research and Central Council of Research in Homeopathy, Ministry of AIIPM, and member of Editorial Board of Asian Journal of Homeopathy. And he was the principal of Kamakshi Devi Homeopathic Medical College, Goa, and principal of Nagpur Homeopathic Medical College and Biochemistry also, and chairman Committee of Excellence of Education in Central Council of Homeopathy, Ministry of AIIPM, and member of Editorial and Advisory Board of Indian Journal of Research in Homeopathy.
We'll continue. Thank you so much.
And he has international collaboration also in Sub College, Switzerland, and Institute of Stuttgart. Am I correct? I don't know. Germany, and Glacis College, Germany. And I'm welcoming you, sir. It's a great privilege for us. We are so grateful to you for coming and taking a session in IFPH. Welcome, sir. And I'll share your slides.
Should I start?
Yes, sir, as you can.
Namaskar. I extend my warm greetings to the esteemed viewers of the International Forum for Promoting Homeopathy. Thanks to my esteemed colleague, Dr. Mridul Sahani ji, for giving me this opportunity. In fact, I would like to compliment Dr. Sahani for his strenuous work of disseminating knowledge to the large number of people. As right now it is said that this is the thousands of webinars are being conducted without any pause. So this is not possible unless someone has a passion for learning. Someone has passion for spreading the message, spreading the homeopathy. Therefore, I express my deep gratitude to Dr. Sahani for such great endeavor. Now, my topic is today case to concept. I have been a teacher, so I will demonstrate only one case, because once you know the reasoning behind the case, then we can understand the application. Since this is a forum for international studies, international colleagues are there, I would like to dwell upon the international status. So, madam, slide please. Slide. Just disclaimer. Whatever the case, clinical material is provided by my colleagues earlier, Dr. Naveen Pavaskar and his team. So clinical material is his. So I take privilege to present this to all of you in the interest of education. Next one. Next. Next, please. Next, please. Madam, next, please.
Anjani ji, you have to move the slide. Anjani ji, Dr. Anjani, you have to move the slide. Are you there? Dr. Anjani, slide is not moving. Yeah.
So let us see the global scenario. The World Health Organization has already recognized, endorsed the homeopathy. So it's a great boon for international community. WHO encourages public to explore this option. As a result, what will happen? There will be a lot of studies all over the globe, even at the individual level, at the institutional level, at the group level. So this is a great thing so far as the homeopathic fraternity is concerned. Second, we have a global organization established in somewhere 1925. This LMHI, Liga. So this also promotes homeopathy in a big way. And all over the globe, almost more than 100 countries have recognized homeopathy, this partially or fully, this way, that way. There are various modes are there. So it's a very good thing in the present forum. Of course, there are so many negative things also, but let us think what are the positive things. So World WHO has recognized us. LMHI is an international organization, and almost 100 countries, almost 60% of the world countries have recognized homeopathy. This is a great thing. Next. So far as next one. Now let us see status in India. India has recognized homeopathy by Act of Parliament. Homeopathy is a recognized system of medicine. Fully recognized. Secondly, it is only in India only we have an independent Ministry of Ayush. Ayush is taking care of Ayurveda, Unani, Siddha, and homeopathy. There is a special ministry for this, established in 2014. And you will be happy to know that in India, the growth rate of homeopathy is 26.3. This is the highest one amongst all the modalities, among Ayush modalities. So you can see the tremendous growth so far as homeopathy is concerned in India. Next one. Next. Now, to regulate all those things, there has to be infrastructure. For infrastructure, we have National Commission for Homeopathy. Earlier, it was a Central Council of Homeopathy, which takes care of education, the undergraduate education and the postgraduate education. And it is the same one, like modern medicine. We have 4.5 years degree course, the same duration, the same textbook, same internship, same eligibility, same one. So this homeopathy is at par with other system. This is number one. So recently, postgraduate studies are there about postgraduate studies are also there. Recently, the National Commission has introduced one competency-based curriculum. That is very important nowadays because products coming out of the institution has to be competent one. And therefore, the National Commission has putting special efforts to bring competency in the education. That means application part. Applied homeopathy is more important application. So that is their role. CCRH is taking care of research, fundamental research, applied research, collaborative research. They are doing work on clinical research is going on. Collaborative research is there. And I'm happy to know that there are collaboration with Institute of Reputation, particularly Indian IITs. They have collaborated with IITs. There was a collaboration with BARC. There is a collaboration with All India Institute of Medical Sciences. And recently, the CCRH is also collaborating with some foreign countries for foreign project. There is a council commission for pharmacopoeia. There is a National Institute to take care of the education. Recently, there was earlier one NIH at Calcutta. Now there is another institute in Northeast Institute of Ayurveda and Homeopathy. And last year only, the government of India has initiated All India Institute of Homeopathy as Narela in New Delhi. So this robust infrastructure is there to take care of the education, research, pharmaceutical, pharmacopoeia is also there. It's a national document, government document. For educations, model institutes are there. All India Institute is there. So India has a tremendous scope to go ahead. Next, please. But there is a challenge also. We are good in education. Research is also going on. But the lack was linking education with research. Research should be a part of education, because education is basic. If we are imparting good education, quality education, then and then only we can produce good researchers. That is very important. So if education is linked with research, probably this will give better result. And the second part is that the research should be evidence-based. Now, all over the globe, homeopathy is good, everybody accept. But for want of evidence-based, people are not accepting. Some people at some forums, it is not accepted. Because Hahnemann has not done this for research or for this purpose. Hahnemann's work, if you look at Hahnemann's life, all his work was experiential. Whatever he has experienced, he has put it on record. Whatever he has felt, he has written. He has not modified into the medical terms, medical language, nothing. It was all experiential. But other people, followed by Boger, Bornebussen, Kane, Allen, so many people, they have added various aspects. As a result, we are in a position to practice homeopathy. Otherwise, only on Hahnemann literature, it becomes very difficult. So, point here is that we have to focus mainly on research. And therefore, we'll study one case. Next, madam. The pattern of education should be, we teach in the classroom studies. Whatever we teach in the classroom, say for example, we have studied belladonna in the class. Okay. Belladonna has hundreds of symptoms. Do you see a patient with hundreds of patients in the OPD? No. Hardly we get 1 or 2 symptoms. So we must understand what are those prime symptoms. So whatever we learn in the class, it is all those things we explain. In OPD, we have to tell the student, okay, look here, this is belladonna. These are the prime symptoms. This was the reason we have prescribed belladonna. And if we go on doing like this, if you see hundreds of patients being treated by belladonna in this group of symptoms, then this becomes a research project in that particular clinical condition. It goes to the research lab. If research also approves, then it goes to the society for the welfare, for the treatment part. This is the protocol. So that has to be followed. So education is not one part. Education is always linked. Theoretical, clinical, research, all those things this is one component. So next point. Now let us see one case. What is this case? Everybody knows it's a case of a burn. Okay? Go ahead. It's a burn, no, earlier one. It's a burn. What is this burn? Burn is an injury caused by heat, chemical, electricity, light, radiation, leading to coagulative necrosis of the tissue. This is a definition. Okay. Next. But what is our approach? What we are going to study today? You see, any case coming to us, there is no fixed pattern. Earlier speaker was also speaking that case decide the approach. A case with lot of mental symptom and all that, it will demand a different approach. PQRS symptom, different approach. Here the case is full of pathology. Emergency case, acute case, pathology is there. So approach is very important. We cannot have the same approach for all the cases, correct? So we'll study the approach. Posology. Posology means the potencies. What potency has to be used in this case? What are the scope, limitation, and opportunities? So our focus will be on understanding scope, posology, scope and limitation, and opportunities. Now let us see the case. Next, Anjali. Next. This is a case, simple case. A 16-year-old girl from a tribal community admitted to the casualty of the hospital. She had burned by firecracker. It was Diwali days. So she was holding a cracker in the hand and it got burned. Okay, go ahead. Next. So the next, earlier. So what was that? This distal phalanx of the finger of the left hand was turned black. Charred tips, all tips. You have seen in the picture also, it was totally charred. The tips were not visible and it was black. Burning was there, bleeding was there, pain was there, and wound was contaminated because what was the cause for wound? It was a gunpowder. It was a cracker. Next. Oh, next one. All her general examination systemic was normal. Nothing is abnormal. Okay. Next. X-ray findings. You see, X-ray finding, loss of tips of distal fingers, and the diagnosis is second-degree burn. Okay. So we got the diagnosis. What is the diagnosis? Second-degree burn. Now, when it's a case of a burn, what is the management? First and foremost is to go for hemodynamic stabilization. Any case like this, because there's a lot of fluid loss. So temperature has to be seen, BP has to be seen, heart rate has to be seen, patient has to be stabilized. Second part is management of pain and hemorrhage and infection. Pain has to, wound stabilization, healing, and rehabilitation of affected part. This is a system, method. First this. Now this patient was admitted in the hospital. They have done their homework, stabilization, wound was cleaned. And then they were told that, okay, this patient will have to go for grafting. They were from the poor family and they were not affording patient. So they said, no, we don't want to continue. And they shipped out to the homeopathic unit. Okay, next. So when they entered to the homeopathic OPD, what was seen? Everybody knows. What is the chief complaint? Ailments from burn. That was the only one thing. What was the wound? Wound was contaminated and burning. Only 3 symptoms were there to be recorded. Very intense symptom. Each and everybody, even interns and everybody can understand that. So these were the things. Now, what is the first degree? First degree burn. First degree burn means damage to epidermis, superficial layer of the skin. Edema is there and no scar. What does it mean? This first degree burn is reversible. And it is reversible. It can be brought reversible within short span of time. Second degree burn is damage to epidermis and dermis. Entire thickness of the epidermis is destroyed and there is a vesiculation. The blisters are formed. This pathology is, some cases can be treated, some are reversible, some are not reversible. That has to be understood. And the third degree is total damage and destruction of epidermis, dermis, and the tissue beneath that. It causes loss, oxygen starvation, loss of protein, electrolyte imbalance. Next. Loss of sodium chloride, potassium level gets increased, causes ischemia. Vital organs like liver, kidney gets affected, causing acidosis and uremia. Next. Usual remedies: cantharis, epismel, arsenic, causticum, calendula, alticara, and many more remedies are there. Okay. But now what we did, not necessary that each and every case requires a repertory. But this is a model. As a student, if you practice like this, eventually it need not go for all those things. Once you set your mind like that, so mind only will do all those things. For this, we have taken totality. What was the totality? First symptom, we have taken burn. Cross references in synthetic repertory, we have looked into convalescent burn. This is first rubric. Second rubric, wound. What was the wound? Destruction of tissue, wound soft, weak torn. This is again synthetic repertory, chapter on generalities. And third one, next one. Ulcer, contaminated burn, burn ulcer. Murphy was used for this. So three important rubric was taken and we have further classified. If you look into the classification of disease, what we see is an acute condition, emergency condition. There is no miasm and no dynamism. So it is a non-dynamic disease, non-miasmatic, acute emergency case. Next. Let us look at the susceptibility of the case. Pathology, structural changes are there. Pathology, structural changes are there. It could be reversible. It could be, may not be reversible. Tissue destruction is there. Is there any characteristic? Nothing is there. And sensitivity is low. Patient was weak and all that. The same thing, what we have seen earlier. Next. Let us see we have followed Boger's approach for this case. What is this Boger's approach? Boger speaks of toxicology and pathology, all symptoms from toxicology and pathology. And pathology has a prime importance. Therapeutic approach is based on clinical condition. So Boger's, wherever any clinical condition, all clinical condition, pathology, toxicological symptom, that is the base for Boger's approach. So that here in this case, Boger's approach was taken, not other. This was the repertoire also. In repertorization, here we get the remedy. Next one. Here, 3 remedies comes at different phases: causticum, Buxol, carbolic acid. Now, look at this thing. Next. Let us look at the causticum. What is causticum? Causticum, as you all know, that it's a deep acting remedy. And causticum would be required in further stage where there is a deep burn and cracks are there, contractures are there, and deformities are there. So in that case, causticum would be required. So that was not the case here in our case. Next one, Buxol. Buxol wound, it is a decomposing ulcer, bleeding, easily spread, and defined edges, margins are elevated. So that was also not simple. Carbolic acid was prescribed. Powerful antiseptic, irritant, anesthetic. These are the words from Matremedica. Burn, inflammation leading to ulceration, putridity. Profound prostration. Acid, we know acid. All acids, there's a prostration. Acid, first strong characteristic of acid is a profound prostration. So prostration was there. Next. Acute strong smell, ulcer, laceration, bones visible. Now correlate with the drug case. You have seen the picture. What we have seen, the tips were, bones were almost visible, crushed, bust slapping of soft tissue. Okay. This is exactly the word what we see in the books, including Allen and Herring's. Some books have not given all these things, but in some book. Therefore, we need to refer many books to understand the drugs. One book is not enough. Prescription was done, carbolic acid 30. And for cleaning purposes, we have used calendula. Calendula, 5 ml of calendula with 50 ml of distilled water. And for cleaning, that was used. And here the multiple doses were used. What is that? We have used multiple doses. Now, why multiple doses? The pathology is advanced. We are giving a lower potency. Susceptibility was low. Therefore, multiple doses were given. Look at the picture. After 6 weeks, this was the picture. Little improvement is there. 8 weeks, still further good improvement is there. So carbolic acid has done its work. Okay. Now at this level, the burning was not there, pain was there, just wound is there, but healing still some deformity was there. Therefore, we have reviewed, and the patient was in the hospital. So again, case was reviewed, and this totality was taken. What was this totality? We have seen ossification slow, weakness, debility, desire for smoke food, tall, thin, pale, dark complexion, thinking was an ailment continuously, desire to move from place to place, chilly patient. This was the totality. Based on this, next please. Calcarea phos 30 was prescribed. Look here. Calcarea phos 30 was prescribed, 1 dose once a week. Earlier, lot of repetition was there. Here, Calcarea phos only 1 dose was prescribed, and look at the result. Look at the result. Much improvement is there. Scab formation is there. Scab formation is there. And next follow-up is still better. Look at the things. Absolutely almost normal. This girl being marriageable, lot of cosmetic problems are there. A lot of social problems are also there. But our drug has taken care of everything. Tremendously good, encouraging result. Very good. We could achieve it. Now, let us analyze why we could achieve this. Next. You see, almost 100% recovery. Okay. Now next. So, acute remedy, carbolic acid. As I have told you, it was based on pathological symptom. Acute can be prescribed even on the basis of the knowledge of mater medica, on pursuing the characteristic symptom. Every time you need not go for repertory. Okay. Next point. Now, doses and repetition. Why we have gone for repetition? This was a remedy from mineral kingdom, carbolic acid. Mineral kingdom means deep acting remedies. So deep susceptibility was low, curative action was expected, low potency and repeated doses. Because of this, we have given low potency and repeated doses to improve the susceptibility. Next point. Constitutional remedy was followed by it based on totality to help to recover the patient completely mentally and physically. Once you prescribe the remedy based on totality, constitutional remedy, that helps in both the way. Patient improve mentally and physically both the way. That is how we have seen in the case. Next one. Now to conclude this entire discussion, I would conclude like this. Knowledge of what from this case, what we have learned for a homeopath, good homeopath, what is needed for us to know. Knowledge of medicine, including all those things. Knowledge of medicine is a prerequisite because knowledge of medicine, clinical medicine, helps you, suggest you the investigations. Further, it helps us to go for diagnosis. that helps us to know the prognosis. So we can know the various dimensions of that particular cases, and we can find the measures for that. So that is very important. Second was case decide the approach, predominantly of clinical. Now here the case decide the approach. That means the case was pathologically general, so were very predominant, very predominant. So since the case has all those things, we have thought of bogus approach. Suppose another case is only few PQRS symptoms are there. You would have prescribed on that one. In one case, acute is there. In that acute, only will take a complete symptoms like location, sensation, modalities, concomitant. Location, extension. Second is sensation, pathology, modalities, causation, and concomitant. That one complete symptom remedy can be prescribed on that. And the Kantian approach, taking life space into consideration, all those things, we can prescribe it. So my point is that don't stick up to one approach. We have to look into what approach is suitable for this case. That is my point. To demonstrate this, say, for example, this case was burning. So in this case, first level, what is the first level? The pathology, pace of the remedy and the pace of the disease has to match. Pace of the disease and pace of the remedy has to match. Why? We'll take this example. At the first stage of burn, the pathology is superficial. Pathology is superficial. What is there? Just a slight inflammation, swelling, redness, edema is there. So what was the remedy? Suitable remedy is like cantharis. It acts on the superficial layer. When pathology goes deeper, second level, damage to the dermis and epidermis, and vesiculations are formed. Other remedy like epismale would also come in that phase. So as per phase, the remedy will differ. All the remedies are there for burn, but based on the phase, the remedy will differ. Third phase, when total damage is there, destruction is there. So a lot of other problems are there. So the remedies could be multiple, different. So always think of phase of remedy and the phase of disease should match together. Then only we get proper results. Potency is also equally important. And finally, constitutional remedy plays a very important role to bring final results. Remember, in this case, where the emergency is there, in this case, it could be a medico-legal case also. Therefore, one thing always remember that whenever this type of case, every case has to be well documented. Documentation has to be proper. Case has to be well documented. And if that facility is not with us because it requires a special setup, stabilization is there. So whenever you want to refer the case, you refer the case to the center where all these facilities are available with your reference that, okay, I have seen the case, this was the picture, and therefore this was the condition, and we are referring it to the other case. That has got to be, and document has to be saved with us also. Okay. So these are the points in this case. These are the learning in this case. I will conclude with a quoting from Hahnemann. Hahnemann says, follow me and tell me the failures. So if you follow Hahnemann properly, probably our failures will be reduced and will be the successful. Today, we have got a good environment. Infrastructures are there, lot many organizations are working. In India, there are 277 colleges, hospitals are coming up. So it's a good, and the good intellectual students are coming. The greatest point, so far as homeopathy is concerned, I think we have a we have a tremendous future so far as homeopathy is concerned. With this, I conclude. Any question, please? Any question?
Sir,
Yeah.
participants, please ask your questions regarding this case or any other doubt. Also, he will answer you. Please raise your hands and ask question to doctor. No one has questions.
Oh, thank you. So I can think, yes, no question, no? So thank you so much, madam. It was nice. And again, thanks to
Dr.
Dr. Mohan and Dr.
Uh,
Yeah.
Yes, I would like to say it's really a very good session, and really we need to work together to bring homeopathy to the topmost level. But what are the things? What all the things you mentioned here are really very, very good and essential for bringing a homeopathy to the next level. This is that's why we are conducting such sessions, because we know that homeopathic medicine works wonderfully, and it has we can undertake whatever case that comes on our way, and we can have solutions with us. But unfortunately, most people don't have no idea about homeopathy. Only those who are undertaking homeopathy as their base treatment are continuing, and though we are not getting so much of propaganda from our medical companies or from the government. We are having but in the other case, as far as the other people are concerned, they are getting wonderful support from the medical companies. They are propagating all those medicine. What are the new things that happens in their field, and that's why they are even they are also publishing the research. Even though we are publishing these things, these things are not coming out to the public. So that's the reason why the International Forum for Promoting Homeopathy has started such a webinar session. And we have brought nearly doctors and eminent personalities from different parts of the world, particularly 65 countries, 65 countries participated in these sessions, and they have explained about what are the things in happening with homeopathy in their own country, and how they manage cases, and what are the support they are getting. But frankly, in India, we are lucky to have such a government. Our government, from the very beginning itself, giving full support to the AIIPM system, particularly homeopathy is a big benefactor. And that's why we have a special department, the National AIIPM Mission, as well as the national research wing. In the early part, we used to say that is the CCR, but it is national research thing. Anyway, these are the things we have to look into, but still we are lacking a lot of things. That is the area we have to work together, because we know that most of the doctors are following this Hahnemannian method. And once we started this session, somebody was asking such a silly question. Oh, you are promoting homeopathy. That means most people will practice homeopathy by seeing all these things. Then that was the kind of, you are promoting coke like that. But actually, it is not. The present situation is entirely different from the old situation, because you just take for example, if you have a headache, you just take the Google and just type headache homeopathy. You will definitely get medicines, but more, people just then they will search for a homeopathic doctor who can give this medicine. And that is the situation now. But we need to look into that also. So that means that we will have to go towards the people then we will have to make a more advertisement that homeopathy, not only that, we will have to publish a lot of cured cases in between from different part of the doctors, and what are the specialization that we can do also. In Kerala, as you know, you have mentioned about the 273 colleges, but in Kerala, we have more than 1,000 government dispensaries and more than 40 hospitals in government sector, where we are having specialized branches for infertility. There are hospitals with specialized doctors having infertility treatment, and we are getting a lot of result. Even 200 successful cases were happened in Kannur Homeopathy Hospital itself. We have a cancer hospital in Malappuram. It is
Dr. Danesh,
sir.
excuse me, there is one question in the chat box from Lada Manoharan. Any special concern about the mental shock at the time of burns?
Pardon?
Any special concern about mental shock at the time of burns?
Mental shock at the time of burn.
Burns, yeah.
Yeah. Correct. The valid question. You see, when burn is there, look at the situation. Burn is there. There will be a shock to the patient, shock to the family also. Okay, that is but natural. So that shock was there. But what has happened? First, the patient has gone to the modern system, means other parameters are there, has approached the casualty, and all the other. Don't think that, you see, what is important is that wherever whatever is needed has got to be done. So the patient has not turned up to you in the very beginning. He has gone to the casualty. So in the casualty, patient was stabilized and all that. And after 3-4 days, he came. So that shock part was resolved to a great extent over there. So if it is too much, then pattern of remedy and all those things will change. Drug like ignitia may come, drug like natrum may come. The shock and all those things are there. But it was not to that level. After 3 days and all that, patient was shifted to this, patient was admitted, patient was very cooperative, patient was visiting to other bed, going there, inquiring with others. So that feature was not there in this particular case. Got it? But I will.
Lata Mohan, I think you got the answer. If anyone have question, please come forward and ask question. Because if one person is asking question, everyone will get the answer. That is the truth.
But I will compliment Dhanesh. Dhanesh has raised a very valid point. First, I will compliment him for organizing such webinars all over. And I am happy to know that almost 65 countries is a part of this venture. It's a very big thing. So this type of activity is required for homeopathy. These people are going, propagating. And second point is that he has cited the example of Kerala. Kerala, there are very few homeopathy colleges. But what is more important is that homeopathy is into the public health. Homeopathy is a part of public health. There is a separate directorate. There is a budget. There are hospitals. Big hospitals are there in nook and corner of the Kerala. That is how Kerala model is very important to propagate homeopathy. That is not the case anywhere in India. Even in West Bengal.
But I'll tell you the truth. Here, the homeopaths of Kerala don't have the courage to take such cases that you have taken now. Actually, for me, it is a miraculous case that you have shared. We don't take, we will send to the allopathic hospital.
Correct. Right.
We don't have, I'm saying majority of the doctors, they don't have the courage to take such cases.
Thank you, madam. Doctors have a courage. What they are lacking in the infrastructure. Our hospitals should have that facility available to manage the emergencies. How many hospitals are having casualty and all that? Casualty setup is different. So don't think that by homeopathy we can do each and everything. There are some cases, there are some points where we require help. That particular setup. Setup is very important. Fortunately, we had the setup, so we could manage that. We could. And if that setup is with us, under our control, under our supervision, that is possible. So we have a capabilities, but infrastructure is not there. But you should remember, you look at the infrastructure in other hospitals and our hospitals, there's a big difference, big difference. So our hospital also need to be upgraded. That is what I would like to say.
And
Good. Thank you.
today, when I go to your slides, I told my daughter to put the slide in the computer, and she was opening and seeing your case. She saw the first picture, then she was. I didn't saw actually before. She was, after seeing the photo, she was, "Ma, see," she was in a like she was. Her face was cheering up like anything. "Ma, see, the fingers are beautiful now. Now it's look so beautiful."
Correct.
Likewise, she's after only I saw the slides, really wonderful, really miraculous.
Okay, compliment to your daughter.
Yes,
Yes,
sir. We need such kind of cases
correct, correct.
to publish among public. So we need to use almost all media, so in printed as well as in other side also.
Right, you are right, you are.
So for
Because-
that, we have to use resources like you people, because you people are having a lot of in the present context, things are entirely different. Our junior doctors are not getting such a opportunity to treat all.
Correct.
Nowadays, there are, as you know, about the so-called medical bill of Kerala. Already there is a medical bill passed by the Kerala, passed in the Kerala Assembly, which state that if a communicable disease comes to you, you have no right to treat the case. You just direct the case to the other side, like that. That's what happened in COVID situation. As we all know that we have the resources with us, and we have the power to conquer the viral infections, whatever that comes in the way. But as far as the other system is concerned, they are having no such nothing for treating these viral diseases. So what's your opinion on that, sir? These are the things we need to change, and we need to work together for that.
No, that decision, I don't agree with that, because there may be different act, and based on some act, they may be prohibiting. But so far as our system is concerned, communicable diseases, we have a very good treatment. You see how homeopathy has started enter. There was a cholera epidemic in Calcutta side. Honing Burgess came and all that. And those time, he has treated those cholera cases. So if for epidemics, there is a pattern. We have to go in for genus epidemicus, and based on, we have to select some cases from different location, different location, find the totality, select the remedy, and give it on a large scale that can prevent. So it has prevented. Those days, even in Andhra, CBT, that Belladonna, Calcarea, and Tuberculum, BCT, that was given for Japanese encephalitis.
Right.
In large scale, on large scale. Some documentations are there. But what has happened, this was a case maybe 10 years back, perhaps, or maybe more than that. So sometimes this come. What is happening today, it is a very competitive era. It is very competitive. You have to be on the forefront at every time. Like in COVID also, everybody, we were very organized, and we were working. Like that all the time. And our publications are very few. If you look at the record of the government side, World War, our publications are very few, negligible. And that too, publication in a in a what we call it recognized journals, which is having large scale acceptability, or there are some standards. So they are saying that our journals, our articles are not up to that level. They have certain requirements. So as a result, the communities overall scientific community has some issues there. But I am sure with the joint effort like this, your association with so many countries, now young people would join us, and eventually thing will come, because this is a science. It requires time. It requires much time. All of a sudden, this doesn't come. So it is coming up. You see what we were as a young people, what we have faced. The situation is altogether different today. We are much better today. So thing will change. It will take some time. It is just a matter of time only. What you are expecting, what your desire is there, I think
Sir, Dr.
we'll achieve it.
Guru Kiran and Dr. Mas also raised hand. Dr. Guru Kiran, you can ask question.
Yes, Guru Kiran, tell me.
Sir, I have been to your webinar. It was a very nice session.
Yeah.
And
you.
one thing I would like to say is, sir, you were worked in a lot of government institutions like Ayush and all department and all. So I would like to say that for the upcoming homeopaths, the budding homeopaths, we should have a channelized thing that they should document each and every case.
Correct.
So that we can build up something, some evidences that they can show it to the other fraternity also. So what is your take on this, sir? If there is any curriculum, or if there is any direct access to CCRH or something like that, we being the practitioners, we have a lot of cases, especially I have a lot of documented cases, and I have presenting since IFPS platform since 2 years. I have presented a lot of webinars there. So if there is any chance to publish those cases, any way or anything like that, if there is any take on this, sir.
Yeah, thank you, Guru Kiran. I will compliment you first of all, because that you have documented the case. Documentation is the first point. Because when you document the case, we understand what are the aspects of it. We understand what is the mental symptom, what is the physical symptom, what is the characteristic, what is the normal symptom, what is the abnormal symptom. That is the entire base of homeopathy. That is very good. That is one point. Very few people record the case. So I will appreciate for that. Second is that you are told that you are having lot many cases on your from your OPD. So you come out with a document with some cases, maybe 200 cases, 100 cases like that of one disease per se. Or you are having one skin problem, you document the cases, RS problem, CNS problem, neurological problem, whatever it may be, you identify one clinical condition. Because in different area, there are different diseases predominant. So that will give us this background also. What are the conditions? So analyze entire cases which you are having. Say you are having 500 cases, analyze the cases. So many cases from skin, so many from RS, so many from this is wise. And then analyze one disease per se. Analyze those 100 cases, and it should have proper case taking. It should have analysis. It should come up with the result. Investigation is very important in all the cases. So all this data, you put it in on a system and prepare a paper. Okay, this. And if that is the case, you have got two things. With that data, you approach the CCRH. Now, CCRH is looking after the research activity. There is a section known as clinical research also. So you send it to the CCRH and they can help you. But for your information, for students and all that, there is a scheme in CCRH. Those who are studentship during student time, study time, internship, or earlier also, the CCRH they give you scholarship for doing some research activity. From your OPDs, you pick up some cases, the student should pick up the cases and submit to the CCRH, and they give scholarship for that. So that avenue is also open for us. So you do take care of these two activities. One, writing to the CCR, forwarding it, prepare the data, prepare a document with all this record, forward to the council, asking them, okay, I would like to do something. And second is the student, because students are very important. At that stage, if they are into the research, probably they will do much more better thing in future. Okay, Guru Kiran?
Dr. Gurukiran, he has many he shared many cases here in this forum.
We are
also.
very happy. We want people like him only associated with Danish.
And Dr. Mas, you can ask question now. Mas, I don't know whether.
Yes. Thank you. Thank you, Dr. Arvind. Yeah. I managed to listen to the second part of your presentation, and I find it very, very interesting. Actually, I have a question, but I don't think we have the time to actually explore in this question, which is pertaining to any experience in treating gout cases with TOFI, the deposits in the joints. Because I was told, we know that homeopathy can produce a lot of miracles in terms of the treatment. However, have we got any successful cases in terms of removing those deposits in the joints, the TOFI, using homeopathic medicine? That is actually my first question. And number two, I would like to request IFPH to call you again, because I find your cases very interesting, so that you can have more sharing with us. And if it is also possible to reach out to you to actually ask for your opinion on certain specific cases. That's all. Thank you.
Thank you, ma'am. Thank you. First point is your case of a gout.
Yes.
With, So
yeah.
With uric acid level must be high, and some deformities are there. So it's a chronic case. It's a chronic case. Okay.
Yeah.
So anything is prescribed earlier at your level?
No. This is not the case that I have treated. This is a general question, Doctor.
General question. Now, in this case, homeopathy can offer you much better solution. Okay. As Dr. Guru Kiran has said earlier, what is the first point needed for this is the case taking. Case taking. If case is properly recorded, then remedy comes on its own, because it gives the symptom. It gives the symptom. So once we get the symptom picture, pathology is there, investigation is done, all those things, that picture is already there. That is existing. What is needed is that we require a picture of a patient. Picture means not photograph. The case taking gives us the symptom picture. Symptom picture, the characteristics, their modalities, all those we get. So it requires a long history to be taken, and the remedy has to be decided. Initially, if it is the initial case, result would be much better, earlier the best. If some deformities are there, it becomes difficult. Look at the homeopathic miasms. If it is psoric miasm, recovery will be very fast and it will be successful. If it is psychotic, it will be little delayed. And 80% will be recovery, 10%, 20%, 15% would be still problem. But if it is irreversible thing, syphilitic, it becomes very difficult to reverse back this case. This is my case, what I have told you. Not that all cases of burn would be recovered. because in that second degree burn, epithelial tissues were there so that we could achieve the recovery. If that would not have been there, probably it would have gone to the next stage and recovery would not have been there. So we have to look into all aspects and then we have to decide. But for your information, there are studies on this uric acid issue, gout, even studies by CCRH. CCRH is the Government of India body looking after research activity. They have one publication, I think lycopodium, they have studied lycopodium in a group of people, and they have claimed that they have got a good result. But don't go by remedy like this. Don't go for lycopodium for uric acid unless and until you record the case, you have a good symptom picture. So like that, you consult some colleagues like Jnanesh or Guru Kiran. They can help you a lot. Okay.
Thank you, sir.
you,
Actually,
sir.
Dr. Mas, if you have more questions, means you can contact him directly. Now it is the time for the Malayalam session. We already late 2 minutes, I think.
Yeah.
I'm sorry, Dr. Shaila. And thank you so much, sir, for your
Yes,
miraculous
I'm also thankful to you.
and,
I have enjoyed a lot in the session.
come again
Thanks.
and share,
Yeah.
educate us for to become
Yeah. Yeah.
more good.
Thank you.
Okay, Doctor, please, Dr. Shaila, please.
So should I?
Yes. Thank you. Bye.
Okay, ma'am.
Thank you,
Thank
Doctor.
you.
Thank you very much.
Convey my regard to Dr. Sahani, sir. It is because of him I could get this opportunity. Thank you so much.
Sure. Maybe he was listening.
Oh,
Yes.
he's
Okay.
our mentor.
Hi.
Okay, ma'am.
Okay. Thank you. Doctor, you can start.